New chikungunya outbreak in southern China. What you should know. What's happening? A rapidly escalating outbreak of chikungunya virus has sickened more than 7,000 people in Guangdong Province, with Foshan City at its epicenter. The outbreak began in late June or early July 2025, and local authorities report it's the largest such outbreak in China's recorded history. China has imposed stringent COVID-style containment measures, including mandatory hospital isolation of those infected, home surveillance, and enhanced travel restrictions in about chikungunya. Chikungunya is a mosquito-borne virus transmitted by Aedes aegypti or Aedes albopictus mosquitoes, the same types that spread dengue and Zika zones. Symptoms typically begin 3 to 7 days after a bite and include sudden high fever, severe joint and muscle pain, rash, headache, swelling, and fatigue. While most recover in under a week, joint pain can persist for months or even years, particularly for older adults or those with chronic conditions. Death is rare, estimated around 1 in 1,000 cases. To why it's spreading now. Heavy monsoon rains, flooding, and elevated temperatures in the Pearl River Delta have created ideal breeding sites for mosquitoes, increasing infection risks dramatically. Climate change is widely blamed for worsening these conditions. That a single imported case appears to have triggered local transmission in July, spreading to at least 12 other cities in Guangdong beyond Foshan. China's response measures. To halt the outbreak, authorities are deploying a multi-pronged approach. Fumigation, use of insecticides, and spraying of public areas. Releasing mosquito-eating, elephant mosquitoes, and larvae-eating fish into standing water sources. Drones used to identify breeding grounds for mosquito eradication. Residents ordered to eliminate stagnant water in containers. Fines up to 10,000 yuan, $1, $400 for non-compliance. And in rare cases, electricity shutoffs enforced. Infected patients isolated in hospital wards under mosquito nets. And home quarantine protocols were briefly adopted in some areas. Travel advisory and vaccination. The U.S. Centers for Disease Control and Prevention (CDC) has issued a Level 2 travel advisory, advising travelers to practice enhanced precautions when visiting Guangdong Province. Pregnant travelers are urged to reconsider travel plans entirely. 2 Chikungunya vaccines, Ixchiq, a live-attenuated vaccine approved in November 2023, and Chikungunya, a virus-like particle vaccine approved in February 2025, are licensed in the U.S. and EU. However, Ixchiq usage has been paused for people aged 60+ due to reported neurological and cardiac adverse events. Full public access remains limited globally. Recommendations for individuals. Prevent mosquito bites. Use insect repellent, DEET or picaridin. Wear long-sleeve clothing. Use air conditioning or screens. Eliminate stagnant water around your home. Check flower pots, bottles, containers. Seek medical care promptly if you develop symptoms such as fever, joint pain, rash, especially after travel to Guangdong. Limit NSAIDs, like ibuprofen, until dengue has been ruled out, given bleeding risk,